What is hypoglycemia? Let me show you what you can do to prevent your sugar crashes. Hypoglycemia is low blood sugar, usually below 60. When your blood sugar crashes, it feels awful. You're shaky, you get cold sweats, you can't think, you feel weak, you're dizzy, you feel like you're going to pass out. So why does your blood sugar bottom out? Usually in response to you eating too much sugar. Your pancreas makes insulin in response to your blood sugar, and sugar gets absorbed quickly right through your stomach, in fact, right through your mouth. We wake up diabetics in insulin comas by putting sugar tablets under their tongue. So when you eat sugar, especially by itself, your blood sugar rises rapidly. That forces your pancreas to make lots of insulin to get that sugar into your cells, and then your blood sugar bottoms out. By now, your brain, specifically your hypothalamus, is not getting enough sugar, which is brain fuel, and you feel awful. You're supposed to go into your sugar stores, which are in your muscle and your liver. It's to keep your blood sugar stable and your hypothalamus happy. People with insulin resistance can have trouble mobilizing stored sugar and can suffer with hypoglycemia. Insulin-dependent diabetics are prone to hypoglycemia if they use too much insulin or they don't eat in time. And some people have such fast metabolisms that they can't skip meals and often need to eat balanced meals frequently, or they can become hypoglycemic. But usually hypoglycemia is a result of eating too much sugar by itself. I even had trouble with hypoglycemia years ago. It would happen at least a few times a week, usually from skipping meals or within an hour of eating sugar. I didn't realize I had an issue until I was in nursing school. One day I rushed to the hospital for my shift and started working without eating breakfast. I was transferring a patient from the bed to the chair and I passed out. I woke up with the patient on top of me, slapping my cheeks. "Wake up, honey," she was saying, and I was wet. She apologized. She got so scared when I passed out and fell, she lost control of her bladder. Thank goodness she didn't get hurt. My clinical professor, though, was furious with me, telling me on no uncertain terms to never come to work without eating and to carry lifesavers in my pocket in case I felt woozy. I had to carry hard candy on me for years until I started supporting my hypothalamus. Within months of starting to take Genesis Gold, I found I didn't have to eat constantly to keep my blood sugar from crashing. I haven't needed to carry any emergency hard candy on me for over 16 years. So how can you prevent hypoglycemia? Well, you can start by supporting your hypothalamus. Your hypothalamus controls your glucose metabolism through a hormone called POMC, pro-opiomelanocortin. POMC also regulates your thyroid, which controls your metabolism, and your adrenals, which control the release of stored sugar, and your protein and fat metabolism. When your hypothalamus is out of balance, so is your metabolism, which means you cannot keep your blood sugar stable. Then you can be sure you're always eating balanced meals, 1/3 protein, 1/6 fat, and the rest of the plate should consist of complex carbs like whole grains, legumes, and vegetables. Carbs will be burned first, then protein, then fat. So your immediate energy comes from the sugar you digest from the complex carbs. Later energy comes from protein and fat. If you just eat carbs, your sugar will bottom out. Now, if you notice you're craving sugar after you're eating a healthy, balanced meal, then you're probably not making enough post-meal cortisol to help your body release stored sugar for fuel until you digest the rest of your food. A little fruit after meals can help. I also developed what I call a cocoa energy ball recipe for my patients with post-meal hypoglycemia. You can get the recipe in our hormone reboot training. Now last, limit your sugar intake to prevent your blood sugar from roller coaster highs and lows. And if you must have sweets, never eat them alone. Be sure you eat protein and fat and a little carbs within a half hour of eating sweets. Nut butter on apple slices or cheese with whole grain crackers will work. Keep trail mix handy to help prevent after dessert hypoglycemic reactions. I'll see you in the next video.